Today we will be demonstrating how to do a treatment on carpal tunnel and where to place the electrodes for this treatment. As you can see, we have 4 electrodes. The upper lateral electrode is two fingers below the crease of the elbow. The lower lateral electrode is 4 fingers below the upper lateral electrode. And then on the other side we have the 2 medial electrodes. The upper medial electrode will be 2 fingers below the crease of the elbow, and between these 2 electrodes we have 2 fingers between the 2 medial electrodes. For carpal tunnel syndrome, we want to see movement in the thumb, the pointer finger, the middle finger and the ring finger, as well as flexion or bending of the wrist. So as I increase the electrodes, we will start to see this movement. The patient will start to feel tingling in their hand and fingertips. And as we go up in intensity of the electrodes, we will then see movement of the 3 relevant fingers. As we go up intensity a bit more, we'll start to see flexion of the wrist and pronation. So that we can see in our demonstration that the wrist is flexing and pronating and the fingers are flexing. When treating carpal tunnel syndrome that presents pain or a painful carpal tunnel syndrome, our treatment would be specifically on the areas of the forearm between the electrode placement into the carpal tunnel and into the palm of the hand, as well as the other side of the hand or forearm between the electrodes and onto the wrist and into the hand. When treating carpal tunnel that presents with symptoms such as paresthesia, tingling, numbness in the hand or pins and needles, we would treat the areas of the carpal tunnel more intensely, as well as into the palm of the hand and into each finger, specifically on the edges or balls of the fingertip, treating each finger 20 seconds to 30 seconds maximum each finger. As the ultrasound head heats up, we need to check that the patient doesn't feel too much heat and we move on to the next finger, as well as feeling the tips of the fingers with our own hands to feel that it's not heating up too much. The treatments for a painful carpal tunnel would take, until we feel some improvement, will take between 2 to 4 up until 6 treatments to feel the effect. When we're treating a carpal tunnel with symptoms such as paresthesia or tingling or numbness, this will take from 6 treatments upwards to feel the effects. We usually would treat a painful carpal tunnel from between 4 to 6 treatments as a treatment series or set, and with a carpal tunnel that presents symptomatically would treat between 6 to 12 treatments per hand. And that is how we treat carpal tunnel with the active vessel system.